Again, this is a controversial area, and even some insurances and things have kind of limited what we're allowed to do at times, but we have to think of the process. So the process of bone-on-bone arthritis is simply means that the mechanical shock absorber between the edges of the bone isn't present. It doesn't necessarily, the cartilage specifically, it doesn't necessarily mean people will have a lot of pain with a lot of walking. It can, but most of the pain that we're using injections for, again, is related to the inflammation. So if the bone-on-bone arthritis causes a lot of inflammation, then the injections can help. They don't change the nature of the bone-on-bone arthritis, and I think there's been implications in some advertising campaigns and stuff that somehow that's being changed. It doesn't do that. But what it does do is calm down inflammation, and if you have an acute painful joint, improving that inflammation helps. The other thing that's like a simple cortisone shot, which is an anti-inflammatory. The gel injections, which are, we call them the chicken fat injections. The cortisone shot's a little bit like WD-40. The gel injections are a little bit more like a grease. And if you have a rusty squeaky hinge, which is another way to think about arthritis, if you want to keep that rusty squeaky hinge going, you can WD-40 it, keep it moving, put grease. All of them are just trying to ease the process, but none of them correct the problem, which is the underlying rust. And so none of these injections correct the problem of underlying arthritis, but that doesn't mean they're not useful for treating the symptoms of primarily related to inflammation and pain. So if someone has a lot of bone-on-bone arthritis, if you will, and only has pain with walking, doesn't have pain at rest and other things, the gel injections are not, and cortisone injections are not likely to help them because that's not really what they're treating. But if someone has a lot of inflammation and pain, the injections can help. The important thing to understand is none of these change the natural history of arthritis, but that doesn't mean they're not useful. They can be very useful to help prevent surgery for quite a long period of time.